Since I became Director of Public Health and Wellness, my team and I have worked to center health equity in everything that we do. This means looking at how decisions we make around root causes, such as housing, healthcare, and food systems, impact the choices that are available to all residents, and therefore their health outcomes. This campaign is important because we know that African Americans and Hispanics have much higher rates of illness and death from COVID-19 than whites. Our data also tells us that our Louisville Hispanic population, people who die from COVID-19, are much younger than whites. We've already seen that our Black and Hispanic Latino residents are experiencing disproportionate high rates of cases due in part to the fact that they are our essential workers and often must go work in environments where they encounter many people. We also know that some of our greatest job losses have come from the hospitality and tourism industry, which disproportionately employs Black and brown residents. That further deepens that already difficult financial situation our residents are facing. So without stable income, housing, and food, it becomes a lot more difficult to prevent the spread of COVID-19. It's important for us to support our residents' ability to stay home from work when they are sick and isolate away from others to stop the spread of COVID-19. As a government agency, we are proud to be able to support residents during these difficult times. We want to make sure that everyone has access to the supportive resources that are available. Benefine can help you connect to resources such as Medicaid, WIC, and SNAP. The state worked to create additional flexibility and expand eligibility for these support services. And so if you didn't qualify for certain benefits before the pandemic, that doesn't mean that you wouldn't qualify now. For example, a new program called Pandemic Unemployment Assistance provides payment for workers who traditionally wouldn't be eligible for unemployment benefits. And the new pandemic EBT application extends support to families with school-aged children. And there's now a special healthcare coverage program. We are encouraging everyone to seek assistance if they need it and not to rule yourself out. So Public Health and Wellness has created systems to support you. If you test positive or become ill with COVID-19 or are contact to a case, we want you to be able to isolate and quarantine without worry or stress. If you're in a situation where you need to isolate or quarantine, we can provide a safe place to isolate if you have unstable housing situations or a household member with underlying medical conditions. We can provide food, medication, and other needs like cleaning supplies or diapers that will be delivered to you. And we can provide transportation or medication delivery if you need substance use disorder treatment. Again, we know these are really difficult times, but we want you to know that we are here to support you through this and that together we will make it through. So just by normal reminders, just remember that our best defense against COVID-19 right now is prevention. The virus doesn't move, people move, so please continue to wear your mask, wash your hands, limit your contacts, and stay outside if you're around people outside your bubble. If we all work together, we will get through this together and we will put out that wildfire.